Mr Speaker, the Office for National Statistics has reported that COVID-19 mortality rates in the most deprived areas of England are twice that of the least deprived. Once again, this virus has reminded us of the extreme health and social inequalities in our society. And whilst it can affect anyone from any background, those from the poorest communities have the highest risk and from severe illness and death. Here in the North East, we have some of the highest levels of deprivation in the country, as well as the highest rates of infection. Can the Secretary of State tell me what the government intend to do to reduce health inequalities, both during the COVID-19 lockdown and as part of our recovery from the impact of the virus?
Secretary of State.
Yes, Mr Speaker, the Honourable Lady is absolutely right, and this is an incredibly important subject, both, as she says, during the crisis and thereafter. We've got a study underway that Public Health England is conducting into the impact of all sorts of different conditions on the likelihood that COVID-19 will hit you hard. It's true that there is a link to levels of deprivation in the same way that one of the strongest factors other than age is obesity, and that needs to be investigated. And we have seen a bigger impact on people from minority ethnic backgrounds. All these things need to be studied, and levelling up and closing that health inequality gap is an incredibly important part of the government's agenda for recovering from this terrible disease.